state of Ohio is about to launch a $36 million project to stop prescription drug addiction in Ohio.
Deb Silverman is in our Butler Warren newsroom to tell us where the money's coming from and how it affects everyone in the state. Deb?
Clyde, the experts say even if you've never popped one of these highly addictive pills, you are still affected by them. OxyContin, Vicodin, Percocet. These prescription medications may do good things for pain, but they can do bad things to people who get addicted. The man who runs the recovery centers of Warren County knows. He sees it every day.
People with opioid addiction have the poorest long-term recovery rate of anyone that we see in our system, and also that they are the most costly people to our system when they fail. Not just our treatment system, but also the courts, law enforcement, the local jail, and even publicly funded hospitals.
The commander of the Warren County Drug Task Force, John Berkey, says the prescription drugs contribute to serious crimes.
An addiction to prescription drugs, and particularly opiates, aren't that much different than an addiction to heroin. And you have to have that drug if you're an addict. So how are you going to get that kind of money? That money's going to have to be generated off of thefts and robberies and burglaries.
Berkey hopes some of the $36 million will go to law enforcement. Most of it is expected to go to treatment and work readiness programs. $9 million of it came from Ohio's alcohol and drug addiction service organizations, and that qualified the state for the additional $27 million in matching federal funds.
Anything that can improve the treatment success, that is the long-term recovery of this population, will serve the community as a whole in terms of reducing longer-term costs. It affects every taxpayer in Ohio.
How this plan will be executed is still in the works. There will be a meeting tomorrow to get this project started.